Welcome to the Healers Café, the number one show for medical practitioners and holistic healers to have heart to heart conversations about their day to day lives while sharing their expertise for improving your health and wellness. Welcome to the Healers Café. And today I have with me Dr. Eva Selhub. She's an internationally recognized resiliency expert, thought leader, physician, author, executive coach, keynote speaker, and spiritual advisor. Now, with almost 3 decades of experience, she previously held roles as an instructor of medicine at Harvard Medical School and as a clinical associate at the prestigious Benson Henry Institute for Mind Body Medicine at Massachusetts General Hospital, where she also served as a medical director for 6 years. Now, there's a lot more to say, but I'm going to just say that you're also the author of 6 books: Burnout for Dummies, Resilience for Dummies, Your Health Destiny, The Stress Management Handbook, The Love Response. And I'm just going to stop right there. There's plenty that is very capturing. So welcome, first of all, to this conversation.
Thank you for having me.
So I guess my very first question is, what led you down this path? Because it's not just the path of becoming a physician. You've expanded that, then you've gone into mind body medicine, which, I'm assuming when you started wasn't overly popular.
Not at all. It was 1996,
Uh-huh.
97, yeah.
Okay,
Yeah.
that's what I'm figuring. So why don't you tell us a little bit the journey and the why?
It's such a wonderful question because, as we get older, we think more about this, right? Of like the legacy, closer to 60 than I am to 50. So it's that period of life where I'm looking back and thinking about like, how did I get here? And, what is the legacy that I want to leave?
Yeah.
And yeah, when I was younger, being a doctor was all there was. My dad was a scientist and my mom was an audiologist, and they were just in the hospital setting, and that's what I was going to do. But I also was, as a young child, also interested in more metaphysical things. I loved Isis, the show Isis, where she was able to telepathically move things and,
But
use her hands to make, energy would shift things. That was just always that and the superheroes. But so really what led me down like moving away from regular medicine was my own suffering. So
yeah,
my personality is one where it's sort of like, let's get it done and let's make a diagnosis and move on. Not really the touchy-feely type, of like really
right,
sitting with people for long times, and which is why for me working in ICUs and in the ER was kind of my personality type and
right.
what I was planning on doing. And in 1996, we had a lot of HIV in our hospital, and I ended up being exposed to it with a needle stick puncture. And
Mm.
that changed the course of my life in 1996. I just had to go on medication to prevent conversion and got very sick and was extremely distressed and started really kind of rethinking my life. And what are you doing? Is this what you want to do? And I don't know. And what if I don't live and nobody's going to love me? And it was just a tremendous amount of distress for a long time. When my blood counts came back okay, I did not convert to HIV. I sort of said, okay, well, I've got sort of a second chance. And what is it that I want to do? Well, I don't really know.
Mm.
But I guess I'll do primary care until I figure it out.
Mhm,
So
mhm.
that was kind of like the background, sort of a backup. And it's
Okay.
what I ended up doing when I got out of residency in 1997. But because I didn't know what I wanted to do, and I knew 96 was actually, what I talked to an astrologer. She's like, oh, that's your Saturn return. You're going to have another one next year. It's like, great. When I turned 58. So, but yeah, I'm really looking forward to that one. But yeah, it was a succession of events that just brought me to my knees. It was a needle stick, and then my dog died, then my grandfather died, then my apartment burned down. A woman was harassing me. I had to take her to court,
Oh my gosh, yeah.
training order. Then my father had a heart attack all within a 5-month period.
Wow. Yeah.
So, and again, with the personality type of someone who's driven and is a doer and a helper and a caretaker, and I burnt out. I
Mhm.
burnt out. So when I finished my residency, I knew that I needed help.
Mhm. Mhm.
And so I knew I needed to learn something new, and I knew that I needed help.
Mhm.
So I was going to be doing primary care for Harvard Hospital, and they had two programs, the Mind Body Medical Institute and the Osher Institute, which did like alternative medicine, like acupuncture. And I just literally flipped a coin and ended up going to the Mind Body Medical Institute where I was volunteering so I could learn, but
Yeah.
also and then a year into that, they asked me to be the medical director. So, and asked me to start giving lectures on stress and stress physiology. So I literally learned on the job and applying mind body approaches, relaxation, meditation, nutrition, exercise, spirituality, social support, the facets of mind body medicine, and started, doing that with my patients.
Mhm.
Started seeing better outcomes. And all the while working on myself. And 5 years into doing primary care, I hated it, for many reasons. One, it just, again, wasn't part of my personality type. I loved my patients, don't get
Mhm.
me wrong, but I didn't like the way the system was changing to what it is today.
Mhm. Mhm. Yeah.
I didn't like being held to having to show up every day at the same exact time. And, the routine of it wasn't for me. But I really didn't like the way the model was changing to what it is today. And
Yeah.
the day I have to see my patients as numbers is the day I have to leave. So I,
Mhm.
I quit my primary care job while I was a medical director
Mhm.
at the
Mhm.
institute.
Yes.
And that's when I started studying with healers. And
Yeah.
again, I was suffering. I was burnt out. I
Yeah.
wanted to learn more. And then whatever I learned went with my patients. I opened up a practice where I merged Eastern and Western medicine together to facilitate the healing process, which I'm essentially coaching.
Mhm.
And I
Mhm.
was being brought in to do lectures and speaking engagements for all different kinds of conferences and corporate. And eventually it just kind of became this thing that I found that I was really coaching, that the medical model was one that supported people to stay victims as opposed to
Yep.
being empowered to be part of the solution. So that wasn't working for me either. And I also wanted to have a greater impact. So I closed my practice in about 6 or 7 years ago, moved it into a coaching model and also into the workspace where I work with employees or leaders to help shift the culture and shift how they're approaching themselves. And really what it came to be was that medicine is life.
Mhm.
And
Yeah. This.
that's it. Medicine is life. And it's everything, that's how doctors used to be, right? We were storytellers. We
Yeah.
connected heaven and earth and helped people, be able to assimilate and navigate life through that. And that's essentially what happened. I just sort of became really good at being an executive coach and coaching leaders and CEOs. And, it's not very different. So
Wow.
kind of where it's kind of gone full circle. And so I get to do all different kinds of wonderful things.
Wow. I really relate, and I don't want to take your time with my story.
Oh,
I'll do a little bit just because I'm getting to know you. But it's funny because my big statement is how you heal is how you live. What we need to decide is how we want to live. And and I was a naturopathic doctor, I got that taken from me. Well, and then I politically resigned in the right way, in the sovereign way. So that, okay, fine, don't I won't use the title doctor, fine, no problem. But it's like one evolves with our own journey, right?
mhm.
And then part of it is not to stick with what doesn't fit, and that's what healing is all about, is not to impose, whether it's the victim thing, that model does not work, for sure. But nor does the natural same model fit, and I've seen it in my own profession. Many of the naturopaths are wannabe MDs, and they're using the old model instead of trusting the patient, their story, that evolution, giving them the power. Anyway, so I'll stop now. But
No,
anyway,
no, I absolutely agree. And even I had this interview the other day, and we were in like also talking about AI. And I said to him, I said, this is the same thing I tell people who are going to be coaches or working in the healing profession or teachers or leadership. It's the same advice. It's the questions you ask.
Yeah. Yeah.
It's not the answer.
Correct. Yeah.
Doctors, leaders, whoever they may be, are looking for an answer. And they're looking for what they think is the right answer. And when we look for what we think is the right answer, we end up being stuck in a box. And then we lose pliability, flexibility, adaptability, which enables us to be resilient and to flourish.
Yeah.
But when we ask the right question, it opens it up to a whole field of experiences and adventures and creativity and innovation and ultimately possibilities, which is the placebo response when we
Mhm.
look physiologically in the brain, right? When we
Right.
go into infinite possibilities in our brain, that triggers the dopaminergic reward system, and all of a sudden our body's healing itself.
Right. And that's the
Same as
creative
what we've done.
state. That's the
Exactly.
creative state, exactly. Yeah, no, it's anyway, wonderful, wonderful parallel, different journey, but it's interesting.
I'm
Yeah.
sure part of it is probably the same. I think we won't go into it, but I think, you're saying that you sort of got stripped of like for me, also resigning from my job at Harvard as a medical
Yeah.
director was also not easy, right?
No.
I was outspoken. I was slapped on the wrist many times at the time for being too spiritual, for being too out there, not following the mold. It's Harvard after all. I
Yeah.
can't blame them.
Yeah.
But, I both walked out and got pushed out. It wasn't,
Exactly.
I mean, I won't, it's not really so true,
Yeah.
um, but I get it. I understand it. I would have pushed me out too.
Yeah.
So it's sort of the notion of there's the ability to think outside of what's in front of us, to know that there are other possibilities and other ways that we can co-create. What I love about, kids today is they really do think that way.
They
I
see.
think a lot of people think it's a problem, but I think it's kind of wonderful that they're saying, no, I don't want to go to school. I want to do it differently. I think that's great.
Yeah, yeah. Well, I mean, do you think that, I mean, I recall being like that myself as a kid, and then eventually you sort of get somewhat indoctrinated into a system, and and I don't know, I think it's when it stopped for me, it's when I couldn't voice my opinion, which was a few years back because of circumstances happening in the world. And I had, I felt I have the right to question things. And so, and I don't appreciate any board or any institution that believes that you don't have the right, because otherwise we can't advance, So I think it's, as a kid, I questioned, and then I continue to question. And I think that's the door that allows the perspective to come in, and real healing and real
That's
evolution, real awakening.
well, I mean, I mean, that's again what I was alluding to, is that if we want to create a shift in our world,
Mhm.
and
What
that's
would
why
your life be like if you were pain free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
that's why my focus has been with leaders, because
Yeah.
leaders
Makes
can
sense.
influence this change to happen, to focus more on not what's doing what they think is right, but to explore questions.
Mhm, mhm.
And when we explore questions, we enable curiosity.
Yeah.
We enable innovation. We enable growth. And we start shifting the frequency within which we exist and that everybody else exists. So right now, But you and I have experienced, and very similarly, I don't like rules. I mean, that was another thing. I just didn't like rules. I don't want people, that's why it's hard to practice medicine when you have to follow so many rules, right? It can also be dangerous. So, you kind of do have to follow rules in many ways, and in other ways, it's too rigid. And especially in the US, it's like it's such a litigious and fear-based way of practicing. There's no freedom and autonomy. So that leads to poor decision-making. So, but again, if we look at our sort of human history, we have innovation and then somebody makes up some rules and this is how it needs to be. Whether it's religion or government or whatever it is, it's a means of initially doing it because you think it's best, like a parent, but then it becomes too controlling and rigid and fear-based. And then that child will buck it and try to find their autonomy, and they'll follow the rules initially and they go, wait a minute, I want to do it my own way. And then they start trying to push their limits and see how far they can go. So it's sort of like parenting playing itself out over and over again. And I think we're being given the opportunity now to say, can we do this differently? Is there a different way to approach this?
Without just repeating the pendulum that keeps swinging one way or the other. So what do you think that is with young people? I mean, what I homeschooled my kids, and less so my third one, because at that time I was so full on with practice and my college, so I just couldn't anymore. But she was also wanting social life. And at that time, I wasn't able to provide it, whereas before I lived in the country, I could do all those things, and I could meet up with. So, I had to change with the actual circumstances that I guess I created, I'll take responsibility for it. But it was a bit challenging to figure that out. But what do you see now? I mean, I have grandkids and full of wonder and asking every question on earth. And where do you see, I mean, you're working with leaders. What would you suggest to maybe the patients listening or other practitioners, that are dealing with younger people? How to encourage them forward? What do you see as an option?
It's interesting because I had this conversation with my niece yesterday. And well, she's 23. And I've been a big part of her life. I mean, since the day she was born, as well as my nephew, who's now 6.5. So I've been really involved. Don't have kids of my own, but I have been very involved in, I would say, in their lives. Let's put it that way. Some parenting a little bit with Maya, but and I said to her this. I said, I'm going to let you fail. I love you. And I am always going to support you. And I'm going to let you fail. And she was like, and I said, because it's not a bad thing. I said, there isn't a single successful entrepreneur who didn't fail a billion times first.
Yeah.
And I certainly have failed a billion times. And that's how I've learned. And why would I deny you that? And why would I deny you the ability to be resilient? Not to mention, why would I disrespect you and your abilities to rise above?
Right,
So
exactly.
I think it's very important for parents, and I had this conversation actually with my client a couple of days ago because he wanted to relate better to his kids. I'm like, stop trying to relate to them. Like, you're almost 60 years old, they're in their 20s. Stop trying to relate to them. Like, don't make it about you.
Right. Yeah.
I said, your job as a parent is to have your life and love your life and love them. You set boundaries, you set structure for them, sort of like when you plant a tree, it needs to have, a place to move upwards, but then it just goes its own way. And you don't, because he's sort of, I worry that they're not resilient enough. So that's why he's always like taking care of things. And I said, well, yeah, if you doubt their abilities, they're going to doubt their abilities too. But what if you said, I believe that you've got this. And if you don't feel that you do, let's talk about it. Let's figure out like pros and cons and what you might need. I'm here to support you. I also believe in your abilities to handle this. So it's not sort of stepping away. It's just stepping to the side. and letting them be who they are and just letting them fail, because a lot of kids are scared of failing.
Yeah. No,
Their
no,
parents are scared
absolutely.
of failing. And because society says it's bad to fail, but let them fail.
Mhm, mhm. Well, I mean, it's funny that that really is a trigger point for me, in that I believe in the concept, and you can fail financially, do all you want. I don't care. Like that's, I'll be there. But when it came to making um, decisions that I felt were uninformed and part of a bigger, um, I will call it just a propaganda machine, pharmaceutical interests, etc. I couldn't help but intervene and just say, we left it that, after this date, you guys decide, but I'm going to send you what I can.
Yeah,
Let's
that's
talk
structure.
about it. Yeah,
But that's structure. You're not saying don't do this. You're saying
no,
I'm going to give you some information.
yeah,
I'm going to recognize that you are so and so years old and your brain isn't fully formed yet.
I'm not going to say
We're
that.
likely, right? And you will likely make decisions with or without my input,
Yeah,
because that's what people do. It's age appropriate behavior.
yeah, yeah,
Okay. So it's recognizing what is,
yeah.
calming your own fear so it's not there and you're neutral going in. And you say, I'm just going to give you this information, do with it what you want.
Yeah.
Whatever decision you make it informed. Don't make it impulsively. That's
Yeah.
all, that's all I can suggest. And with that, I trust you. I
Mhm.
trust you to make the decision that's right,
Yeah.
whatever that may be.
Yeah.
That's
Well, I
very,
think,
very different than I'm worried about you.
oh yeah, no, that's a different story, but I'm thinking a lot of, parents. In my case, I did draw the line. I made a few exceptions because I couldn't help it myself. And did you see this? And what about that study, which we're all denied. It's like, no, 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 we trust the whatever, the structures that be. But some parents forced it on their children because of their belief systems, right? So it's also the other way. If you can have such a belief that you are ultimately right, or you control their destiny, you don't. I mean, that's the piece. I think it's like you're there, you offer, and then you got to step back. I mean, I think that's the art, and it's difficult, and a lot of people are now suffering from that realization that you're sharing.
It is. And look, again, I'm not a parent. I have no right to tell people how to do anything when it comes to parenting, so it's not my place. But I do know how I work with clients and their kids and my niece and my nephew and employees and that sort of thing, and why when burnout happens, because people are lacking autonomy, they don't feel like they have a voice, they're feeling they're being controlled. Again, it's human behavior playing out. The mother, father, child, whatever, just playing out in life. And so how can we change that frequency?
Yeah.
We can, ask questions. Oh, how interesting that you want to do this. Tell me more. Tell me what. So rather than saying, here, listen, like, here's the information, again, it's just a suggestion. We ask questions. So, oh, really? That's super interesting that you want to do that. How come? Tell me more. I'd love to understand this. This is what I understand. Can you tell me what you understand? Like what is like I want to hear more. So when we open that up to that sort of frequency, it's actually full of honor and respect, as opposed to I worry about you, you don't know what you're doing, you're a teenager without much of a brain, and here, read up on this. Just different.
Yeah, yeah, yeah. No, and it also makes the other one more like they become fully responsible for their decision, right? It doesn't trigger the oh, the parent is to this or to that. It really comes to, oh gosh, I have to live with my decision. Do I really believe what I'm repeating? you know
Right. And there's no weight around whether or not I'm going to disappoint my parent.
No, but yeah, that I don't like. I haven't seen too much of that way. I
It
mean,
just happens, even though we're not aware of it. The more like when I dig deeper into sort of my own psyche and with the feelings that happen within me, there is a lot of guilt in there or disappointment that I'm disappointing my parents or something like that. And it's really subtle. It's not so obvious. So again, when we approach something with love, and I love you, and there's you really it's again we have to put on our own mask, right? We have to get into our own place of equilibrium within ourselves, which is the tools that I teach people, is how to regulate that response, how to achieve emotional equilibrium and intelligence to step outside of that and be more mindful, be more present. And, it's sort of what a heart-centered detachment, if you will.
Yeah. Yeah.
To be in a heart-centered detachment when we're with family, boy, we've got to be pretty enlightened to be able to do that. But, it's a goal. It's a goal.
Yeah. Listen, our time is like up again. I feel like we've only just such a tiny bit. I have so many more questions, but anyway, we can do another
We can
interview.
talk again. Yeah.
Yes. Is there any final words you want to share?
I think leaving on that note is I know that people have a lot of worries, whether it's about the future of the world or their finances or their health or their loved ones, which is normal. And the first focus is always you, is to have compassion for you, to take care of you, to fill yourself up with love and compassion and nurturing and fill oneself up to a place where your cup can runneth over. And then you'll be able to be in that place of heart-centered detachment and to navigate your world as you can, as opposed to out of fear or worry.
I'm going to leave it with that. I completely agree. Thank you so much for spending your time and having this conversation.
Thank you for having me.
So with my meeting with Dr. Eva Selhub, many interesting points were raised, and I'm just bringing it back to my community of Bowen College practitioners in their relationship with their patients. I think a lot of what was shared definitely applies in many ways. You guys are guys and girls, or whatever, guys and girls are leaders in the healthcare movement. And it's really important that your clients, well, you yourselves first and foremost, but also that your clients or patients are thinking of like using their imagination, their curiosity, and all of this really helps when you allow them to explore questions. So it redefines a little bit authority, and I always say that many times we don't know, we can't know the results of what we do. But for sure, we can say in our experience, we've seen many cases, but for any individual, there's so many factors involved that we can't know the results, right? But we can definitely explore questions so that they're thinking what other choices might be available to them, and it may position the work with fascia and with Bowen in a very positive light. So what you want to do are points that Dr. Eva mentions directly. You want to enable curiosity, you want to enable innovation, you want to enable growth. All of that, if you can have that type of energy in relation to your client or your patient, there's going to be a lot more respect, more teamwork, more follow through, and you're changing literally the frequency because you're coming in with a much higher frequency to the entire engagement. And the thing is too, just like we need to learn to do with our children, we need to let them fail. And as an entrepreneur, well, failure is part of the thing. You fail and you constantly fail and you pick up your boots and you start again. And if you're a new practitioner and you're trying to get seen and known in the market, you're going to fail. And eventually if you continue and you're being authentic to yourself and you see the work, you get the results, you will win. So it takes failure sometimes to win. It's not an absolute necessity, but let's say that by and large, most entrepreneurs who succeed have failed. So it's getting up from the failure and moving forward that makes the difference. Now, if we turn this to our patients, they have definitely, by and large, failed at whatever they've tried before. So it's kind of a parallel. If we can engage the best part of them to make the step to go forward, in this very moment, there is possibility, and therefore there is change possible, and therefore they indeed might get better. So it's kind of shifting a little bit the the onus of responsibility back to their engagement in their own therapy. So thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.